In today's video, I'm going to take you through 5 things that may mean you need to consider a knee replacement. So keep watching until the very end because it is an invasive surgery. It's a big decision and it's not one that you want to take lightly. Point number 1 is that you have genuinely exhausted conservative treatment. There are very few instances where you should be referred straight for a joint replacement without trying some conservative treatment first. Conservative treatment normally involves support from a physiotherapist or physical therapist, and they will discuss education and advice, exercise, and normally weight loss management if appropriate. And even the education and advice component can be really helpful in facilitating improvement in your symptoms, from reassurance that movement is a good idea, to education about the condition, to managing flare-ups, talking to you about different braces and supports, topical gels and creams. The list really does go on. But the message is there is lots of different things that you can try to decrease your joint pain, and you want to give them a good go before going for surgery. Point number 2 is pain. Now, we're talking quite considerable pain that's getting in the way of daily life and is not responding to point number 1. And it's really important that when we are talking about osteoarthritis, we appreciate that there is a massive spectrum of severity and it varies significantly from person to person. So you could be at the good end of the osteoarthritis spectrum and be able to play a couple of hours of tennis and have a slightly stiff knee the next day. Or you could be at the more severe end of the spectrum with your symptoms and pain and be getting quite consistent night symptoms, be struggling to weight bear, and it be having quite an impact on all of your life. So where you fit on that spectrum of pain severity and for how long you've had it will dictate whether a joint replacement is appropriate or not. This leads us on to point number 3, which is other factors that this pain is affecting. So if your pain is starting to consistently get in the way of your sleep, and it has done for a prolonged period of time, that is not good. If your pain is starting to affect your mental health, obviously that's not good. It might be that the fact that the pain is getting in the way of your work and your ability to earn a living. All of these factors should be taken into account when you're considering a joint replacement. And the more invasive your pain is and the more other factors are affected, the more you may want to think that a joint replacement could be a good option for you. Point number 4 is significantly reduced range. Now, it's important when we talk about range that we are talking about genuinely reduced range of movement and not pain limited movement. So I see a lot of patients that have movement restriction, but the reason that their movement is restricted is because their pain levels are high enough that they just don't want to push too much further because it's sore, which is understandable. But actually, if we were to reduce the pain, the movement available at the joint is still actually there. So that's not what I'm talking about. What I'm talking about is a joint whereby the amount of space in the joint is significantly reduced and not enabling you to move through your full range of movement. And typically what that is going to feel like is a very stiff joint. It's going to feel like there is a mechanical block in the joint. So with knees, we often see people that have a fixed flexion deformity, and that is where your knee is just stuck in a slightly bent position because you no longer are able to fully straighten your knee. Or you may also notice significantly reduced flexion and you get to the end of whatever the bend is and it just won't go any further. It's incredibly stiff, and that could be a reason to consider a joint replacement. And point number 5 is an X-ray that shows a significant amount of osteoarthritis. Now, I say this one with a degree of caution because X-rays do not always correlate with pain. So you can have somebody that has a fairly ropey looking x-ray with not much pain, and vice versa. So you can have high levels of pain with not much radiographic change. So what we're talking about is all of the things we've discussed so far, so significant symptoms in conjunction with an x-ray that shows at least moderate, but moderate to advanced osteoarthritis. It's highly unlikely that a good surgeon is going to operate on a joint that has early or minimal amounts of osteoarthritic change. If you would like more help to manage your osteoarthritis conservatively, then there are free guidebooks below for osteoarthritis, knee pain and hip pain that you might find beneficial. And if you want some more bespoke, tailored, personalised help, I do offer very few limited private appointments on a weekly basis. You can find a link to those in the description below as well. And if you found it helpful, please do like and subscribe. It means more people are likely to see the video that you found helpful. And whilst you're doing that, I'll see you in the next one.